Good afternoon, everyone. You are very welcome to the Masculinities and Men's Health What Does Real Change Look Like webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Lorcan Brennan, Training and Resource Development Manager with the Men's Development Network. Thank you.
Hello, everybody, and you're really welcome to another one of the series of our webinars here with the Men's Development Network and our partners. Really lovely to be here on a Wednesday afternoon. It's a fine day in Wexford. I hope it's fine wherever you are as well. And today's webinar is focusing, as always, on masculinities and men's health. But today we're putting a special lens on what does real change look like. Colleen has already said that for us, and she's minding us there with her team in the background. Kalina, thank you so much for that, being here with us today. In a few moments' time, I'm going to introduce one of our partners who's going to talk to us and contextualize why we're here for the next hour or so. But first of all, I just want to acknowledge the fact that these webinars are brought through a lot of work by key partners who are involved, and the Health Service Executive are part of that partnership, as is the Men's Health Forum in Ireland, and also, of course, the South East Technological University, which is now part of this series of webinars as well. Now, we hope to have another webinar in November, so we hope you're going to come back to us even after today, because International Men's Day will be coming along at the end of the month, next month, and if you can join us for that, it would be fantastic as well. Just to say as well, as always, Fergus Fox from the HSE will join us later on, and Fergus always comes in and he gives us an update on exactly what might be happening in the near future, things to watch out for, so please do stay on for that as well. Helene has already mentioned the Q&A bar, and we have two guys there at the moment, Colin and Finian, who are keeping an eye on that. So if you have any experience that you want to share, if you have a question, they'll certainly try and find the answer for you, and they'll certainly come back to you in relation to that. Now, in the next while, we're going to bring you some really good presenters. We'll have a lovely panelist discussion. The people we brought along are really, really interesting, so we hope that you are going to stay with us for the next while. But before we even go there, I'm going to introduce you to our first speaker, who's going to contextualize this webinar for us. And that's Dr. Noel Richardson. He's up there in the screen already with me. And Noel has been so much part of men's health on the island of Ireland. Noel, I could go on forever talking about the background to your work, but I suppose just to say that you are the director of the Centre for Men's Health in the South East Technological University. You're seconded half-time to the HSE with responsibility for men's health policy and implementation. You've been involved in policy, research, resource development, capacity building, you name it, Noel, you've been very much involved in it. So it's lovely that you're here to start us off and contextualize what real change looks like in the context of masculinities and men's health. So I leave it to you, Noel. Thank you very much.
Thanks, Lorcan. I'm just going to share my screen now, 1 second. Great. Hello, everybody. You're all very welcome. It's a fine day here in Kilkenny as well, Lorcan, so it's great to be here. I think an important starting point for today's webinar is the question in the title, actually, what does real change look like? And I'm sure most of us would agree how important it is to periodically take a step back and ask questions of our work. And I think men's health is no different, really. And I think it's really important in terms of how we might engage men in health programs and sustain their engagement over time by asking fundamental questions. And I remember when I started in men's health, probably about 20 years ago now, I was interested to note that some of my colleagues were asking questions like, where are the men and why are men not here? Sometimes in language a bit more colorful than I would use in a webinar. But over time, I suppose those questions became a bit more sophisticated, and they asked questions like, well, what do men want, or how can we make our service or program more appealing to men? So in terms of setting a context for today's webinar, I think one of my most important tasks is to emphasize how important it is to ask questions of our work. Even if we start with a very basic question, where are the men? I think this over time can bring us to looking at kind of what real change would look like. So in terms of masculinities and men's health, what does real change look like? I think the focus of today's webinar is on a few key things. It's looking beyond individual behavior to focus on systemic or cultural change within the environments in which men live, work, and play. So the presentations we'll see later from Aisling, Shane, and Diana aren't just focused about health behaviors or changing lifestyle behaviors, for example, or mental health. They're much more about bringing about sustained systemic cultural change within the organizations that are being targeted. So that's a really important starting point. And allied to that, we're looking at trying to reframe men's health, men's attitudes and approach to their health. So, and again, this is crucially important in bringing about more sustained change over time. So that's really important to emphasize. I would like to just to highlight at the start, how important it is that the conversations on masculinity sometimes gravitate towards this more kind of stereotypical portrayals, the kind of alpha male type characteristics that typically focus on a fixed or narrow set of behaviors, with little account being given to the context of these behaviors. And thankfully, we have a national men's health policy that sets out a much more kind of nuanced framework to understand how masculinities are shaped by the environments in which men live, work, and play, and also how gender intersects with other aspects of identity to produce multiple masculinities that that intersect with things like social class, ethnicity, sexual orientation, and so on. So it's really important that we look beyond this kind of narrow construction of masculinity as a fixed set of behaviors that are endemic or entrenched in men, to understand how masculinity is as a much more fluid concept, that's gender intersects with other aspects of identity, as I've mentioned, and that gives us a much more holistic and total view of how masculinities operate. What's also important is that our National Men's Health Policy and the research which underpinned it set out a broad set of principles that help us to understand gender a bit better. So in our National Men's Health Policy, we talk about a key set of principles like a social determinants approach, a community development approach, engaging with other government departments, so not looking beyond health, for example, adopting a strengths-based approach, and it's all focused on men taking ownership of their own health. So it's really important, again, to understand the kind of the key principles that are allied to gender, that we don't look at gender in isolation, but rather as in context of other sets of key strategies to engage men. The WHO sets out a really nice kind of continuum, if you like, of what gendered approaches to engaging men or women look like. And they start from gender unequal or gender blind perspectives. And it's interesting, even at this stage, a lot of health policy documents do adopt a gender blind approach. They don't really consider gender at all. So as we move down through this continuum, we move towards what we call gender transformative approaches to engaging men. And this is really where it's at. And this is where I think the programs that we'll hear about later in the webinar offer us really insightful examples of what gender transformative approaches to men's health looks like. And it's looking beyond that kind of set of individual behaviors to understanding the context and the environments in which these programs are delivered. I would just look at the language that's used and maybe wonder about that in good ways to transform harmful gender norms, role and relations. I think the word harmful is a bit judgmental, and we need to consider gender patterns of behavior in the context of wider issues that I mentioned earlier. And it mightn't be a great approach to, apportion the blame to men at an individual level, but rather to understand the context more broadly. So this kind of gender transformative approach to men's health is really important. This slide also sets out how we might go about developing or applying gender transformative approaches to men's health. And a key point here is that it's got to do with program design, program implementation, and program evaluation. So there's kind of different layers to what gender transformative looks like. And in program design, we need to engage men from the outset. We need to have gendered approaches to the implementation of programs. And crucially, we need to apply a gender lens to the evaluation of programs also. And these are some of the engagement strategies that we might find resonate with some of the presentations we'll hear later. We've spoken about these before, but just to summarize, they adopt a very much a kind of strengths-based approach, engaging men from the outset, listening to men, what they would like, engaging men as partners in the development and implementation of programs. And these are context specific. It's not the same set of rules that work for every situation or every context. So we need to adapt and modify these as we go. A key part of this, so it's really important that we look at engaging men, but we also need to think about how we can build capacity within service providers to bring about sustainable and real change. And our Engaged National Men's Health Programme is really important in that regard. And again, it looks at not just equipping service providers with the skills to effectively more engage men, but it also looks at trying to transform culture within the organizations that these service providers work in. So that's a crucial point as well. And also, it's not just looking at health services. And the most recent addition to Engage on Firm Ground, where we're working with ag advisors to engage farmers, is a really good example of trying to broaden the net in terms of who can engage men effectively, and brings about a kind of blurring of the lines between health and non-health sectors in a positive way. One of the first programs that I was ever associated with was the Men's Health and Wellbeing program in the Larkin Centre in Dublin. I just come back to this morning before I hand over to the others. I think it emphasizes a key point, which is about valuing the men who engage in programs. There's nothing here about smoking reductions or change in alcohol or increased physical activity, even though they were objectives of the program. The key point here is that the men were engaged as partners and in a very respectful way. So this was the language that came through in the evaluation. Accepting, nurturing, supporting, listening, etc., etc. So this really set the tone, I think, for a lot of the work that followed, and it's instrumental to bring about real change and sustainable change. And I would like to mention another program which we're not going to deal with today, but again, just to emphasize a couple of things about this, in terms of the program engaged with the target group from the outset. They gave careful consideration to what the men wanted. It was a partnership approach, which is really important, and we'll hear more about that later as well. And it used some of the kind of generic principles that I spoke about earlier, the gender-specific strategies for engaging men, which are really important. And finally, we'll hear from Aisling later about a men's sheds program. But again, this is an earlier study that informed the Sheds for Life program. And no more than the Larkin Centre, it talks about valuing the men and respecting the men as being crucially important. So the findings talked about using and developing new skills, feeling a sense of belonging, supporting and being supported by peers, and contributing to community. These were the things that contributed to men's overall well-being. So in summary then, before I hand over, or we'll look at a video on the men's shed, just to build on this, the key points I think we need to make this morning is, it is important to ask questions, even if we start by asking where are the men and build from there. That's moving beyond the gender blind approach, which is really important. It's also important to look at gender beyond the scope of individual behaviors and to seek to understand how gender operates in complex ways and intersects with other things like social class, ethnicity, race, etc. And gender isn't fixed, it constantly shifts and changes over time. And if we are to bring about real change, sustainable change, we need to engage men as partners from the outset in our work. So I'm going to transition to, before we get to Aisling's first presentation, we're going to show a short video on men's sheds, which kind of exemplifies some of the points I've been trying to make here. Thank you very much.
The shed started here about 2 years ago, just over 2 years ago, and it started, there was just 7 or 8 of us involved. We used to meet once a week in the local soccer club.
I retired 2 years ago and I wanted something, I knew I wasn't going to sit at home. So I came in here to join the men's shed, and one of the best things I ever done in my life was to join the men's shed.
I was retired 3 years before I joined the shed, and I was in dire need of finding something because I live in the countryside, and talking to the dog all day is not, it's okay, but it's not these needs things.
You come in here, you have real human contact, and I think that's the lovely part about it. And there's a sort of a unity in the group, and every new person that comes in here, he's made to feel just welcome.
John Evoy originally started up the sheds around the 2009 mark. 1998 they would have started in Australia, and John had the foresight to see that this could really kind of foster and grow in Ireland.
So I first encountered the men's shed through my father becoming one of the founding members, and he worked here for a few months with all the rest of the men, and one morning he passed away here suddenly one morning in the shed itself. A few months later, myself and my sister were doing a big fundraiser concert, so as part of that we had an idea to ask the men to sing a song.
At first the lad said absolutely not, but she convinced us and brought us round.
You're never too old to start something. One of the men here is 73 and he never heard his voice until last year. He never heard that he had a singing voice, which I find amazing. And all of the men here and their interaction in the shed, they're finding out new things about themselves all the time.
It's the fact that there are things out there, and being in an organised group, you'll look for it and you'll find it. Whereas on your own you might not.
When you join a shed, you walk through that door, everyone's equal. And that's very, very important for people. There's no hierarchy, there's no one telling you what to do. You set your own agenda, you go in there and you meet people, and you meet other men from similar backgrounds or quite diverse backgrounds, who all of a sudden when they come through the door, you leave everything at the door.
It's not like a committee dictating to the members, this is what we're going to do next. It's more a question of, what would you like to do next?
We come to the men's shed, well I certainly do, because it's something to look forward to. And it's a break in the day, and I'm still working at various bits and bobs, but I just will not miss my time coming in here.
Well, I think what keeps people coming here is the camaraderie.
Oh, we love the camaraderie, and we say we get a companionship and we get a bit of crack. We have a good time here, and we do a bit of work as well.
Go down, have a look, talk to people.
It's for everyone, it's for every man.
I recommend it to every man in Ireland.
Thank you so much, Noel, for that really super contextualizing what we're going to be about here for the next hour or so. Still really, really good overview and oversight of where we want to go next. And what a really powerful video that actually demonstrates so powerfully what real change can look like. So we're in for a treat, I think, because we have a lovely follow-on from that video, which makes absolute sense, and it's from Aisling. And Noel's already mentioned the names that we were keeping hidden in the back, but we have some really good people coming up along to be here with us. And Aisling McGrath is going to join us now. And Aisling is a researcher and lecturer in the School of Health and Science in the South East Technological University. She's been very, very much involved in relation to the Sheds for Life programme, and her work has involved co-designing men's health promotion and the men's sheds, with a focus specifically, I suppose, on what Noel was talking about, encouraging men to engage with health and well-being more meaningfully through gendered approaches. So Aisling, I'll leave it to you, and I know it's going to be really, really insightful as well. Thank you very much.
Okay, thanks Lorcan for that lovely introduction. It was lovely to see some of the familiar faces in the Kilcockman shed as well. So I am just going to spend a few minutes. I'm really looking forward to the discussion today, but I just want to introduce Sheds for Life. So Sheds for Life is a community-based men's health program that we delivered with men in the men's sheds. So we brought the health promotion to the men in that setting where, you know, it was safe and it was familiar. And I just want to talk a little bit about, I suppose, why that worked today. So just to set some context, and I guess to reiterate a lot of what Noel had said, and along the vein of this, I suppose, conversation is for real change to happen. The question is, I suppose we really need to know how to talk about masculinities and are we doing that right? So we can say men have some worse health outcomes compared to females globally. And we know it's due to a host of complex reasons. And also, yes, aligning to dominant masculine traits can conflict with reasons to seek help and conflict with health promoting behaviors. But as Noel said, we know it's a little bit more nuanced than that now, that there's a diversity of masculinities and there's so much evidence to show that men do want to seek help and that they are trying to do that and that they want to engage in health promoting behaviors. But we often refer to men as being hard to reach in health promotion. And the question really is, you know, are they hard to reach, or are we failing to reach them in terms of, are we adequately versed in good gendered health services? Do we know how to talk about it? Are we addressing the structural barriers that men face when they do come to seek help? So that's really important. And we can look at, you know, changing the men in terms of you know, trying to increase their engagement with health and wellbeing, but also we need to change the system. And that was kind of the underlying premise, I suppose, of Sheds for Life. And so why did we deliver, I suppose, health promotion in the men's shed setting firstly? So the men's sheds are community-based grassroots organizations, and that video summed it up really well for you all there. And there's so much global research out there now to show that they're really health enhancing before you bring any type of health promotion to them, for all of the reasons that you see here, and that there's social support, they're inclusive, there's shared learning, there's skills, particularly for maybe older men going through major life transitions like retirement or bereavement. And because of their non-clinical and familiar environment and the social support they offer, they do appeal to a diverse group of men, and men that we would consider maybe hard to reach in terms of maybe being socially disadvantaged or marginalized, or maybe there's some mental health issues there. So they present a really important opportunity for us to engage men, but it's how we do that that's so important. So Noel would have spoke a little bit about that as well, in terms of maintaining this really important environment and this sense of community. So we never want to undermine that. So through an invested process, I suppose, of engagement with the men in the sheds and relationship building and trust building, we co-designed Sheds for Life along with the men, the Men's Sheds Association, and also all of the partner organizations in the community that you see here. So we came up with this 10-week initiative. It began with the health check. There was weekly physical activity, healthy eating, mental health, as well as optional components that you can see above. So this gave men a sense of autonomy and control over Sheds for Life, and also allowed sheds to tailor Sheds for Life to suit the individual needs of their shed. But what was really important about it, it wasn't the content, yes, was really, really important, but just want to stress that it was the gendered approaches. So understanding masculinity, how important that was, you know, in terms of the co-designed approach, the hooks that we used, that it was strengths-based. We were tapping into the expertise in the room, you know, from the men themselves and giving them that sense of autonomy. So that was really important. And there is an outcomes paper that I sent a link there. I think Helena is going to kindly share that with all of you. But I suppose what I want to kind of stress, yes, there was sustained and important changes in things like physical activity and mental health, and we were able to demonstrate that it was cost effective. But really the legacy of Sheds for Life was that it began to, I suppose, reframe shedders' perceptions of what it meant to talk about mental health, what it meant to talk meaningfully about health conversations. So Sheds for Life facilitated that and left that legacy there. So the conversations about health and wellbeing became reframed as, I suppose, not weak, but a masculine, manly thing to do, to be able to talk to one another about that. And one of the shedders really summed that up quite well in one of the quotes that we can see here, that actually the perception out there is that men don't talk, but they do. They will talk, but it's the environment and the approach that we take is so important. So I just wanted to leave you with that message that men will engage, but our focus should be on limiting the barriers that prevent them from doing that. And so that's really the message I'd like you to take away. And if you want to find out more information about the research, we do have a paper that captures the experiences of the men in the sheds and their experience of Sheds for Life coming out soon as well. So if you want to keep an eye on that, you can feel free to contact me or to follow there as well. So thank you very much.
Aisling, thank you so much. And as I said at the beginning, I knew that would be just really, really interesting, good. And again, yeah, really looking forward to the panel discussion where we will tease out some of these insights that you've just given us along with Noel as well. And it's a nice introduction because that last slide, Aisling, you had, we talked about men talking and depression. Shane O'Donnell is coming in on the screen there now, and Shane has been involved in many different aspects of men's health on the island as well. And he's going to talk with us in a few moments. But I suppose, Shane, your own expertise has been in the area of mental health and your own piece of research in relation to middle-aged men in Ireland and in relation to suicide. You have a lot of experience as well. You're a young man with a lot of experience that have been out in the world. And I know at the moment you're also health promotion officer with the HSE. But you want to talk to us about Cordia because you've been involved with the construction in relation to mental health, and certainly looking forward to talking with you on the panel more about that. We'll let you off with your slides at the moment and tell us a little bit more about your experience there.
Thanks very much for that, Lorcan. I'll share my screen now. Yeah, so this is the Cordia project. So Cordia stands for the Construction Industry Alliance to Reduce Suicide. So I suppose what we are developing is a multi-level intervention to try and support people around their mental health and suicidal behaviour in the construction industry. But why are we doing this this study? So, well, yeah, why the need for this study? So in other countries, we have research and data around that men in the construction industry have higher suicide rates compared to the general male population. And we also know that the general male population in Ireland, the suicide rate is 3.5 times higher than the female rate. However, we don't have that data in Ireland for kind of the levels of distress or anxiety or depression amongst people in the construction industry. So that's a major part of this project, as well as developing different training and resources that might be able to support people. So, you know, we talked about masculinity already and how that might be have an impact on mental health. So, you know, weakness to seek support, stuff like that. But I suppose it's perceived to be intensified in the construction industry. A lot of people might say it's a kind of a macho culture. There's also other factors like social and job specific factors. So people's background, ethnicity, education, but also long work hours, work schedule, and time pressure, things like that. So what are we doing about it? So I suppose these are kind of the 4 parts of our project. So the first one there is to understand the problems. We've just finished a large scale survey which asked 1,645 men about their mental health. So you can see there the percentages of people who have experience of anxiety and depression in the past 2 weeks, and who also have experience of suicidal thoughts, attempts, or have been lost a loved one to through suicide over their lifetime. So, you know, quite high numbers there. So now we have this kind of research or data to build. Another part of that we're doing at the moment is talking to men as to why they might be feeling like this. So the second one is understanding what works. So there's been lots of programs and interventions run in different countries. So we want to use some of that knowledge. So we're looking at what the evidence is there of how to reduce stigma amongst men in relation to mental health, but also how do we improve general mental health outcomes in male-dominated workplaces. So from this, then we're going to develop our program, and what that's going to consist of is a general suicide awareness training that's specific to men in the construction industry. So Aisling talked about Safe Talk, so it'll be something similar to that, but would have more kind of specific tips and tricks that are related to the construction industry in Ireland. Also be developing a suicide intervention training. So how, if someone was suicidal on site, how would you intervene? How would you support that person to refer them on to professional support? Also linking in existing professional support in the industry, so EAP and counselling services, and also 24/7 support, telephone support line, awareness raising campaigns, so things like World Suicide Prevention Day, Mental Health Day, also developing resources and toolkits that might be able to go on site, and finally capacity building, so policies and procedures for how to support workers on site around their mental health. What do you do if there's been a critical incident on site and things like that. So you can really see it's kind of a suite of resources, not just focusing on one thing. We're trying to have it at multiple different levels. So what does real change look like? So I suppose we're only at the beginning of our program, and so we can't report on the outcomes of the program to say what the change looks like. But I suppose what I see as a real change is the incredible buy-in and partnerships that we've built on this so early on. So I suppose from the national level, the fact that the National Office of Suicide Prevention, the HSE, the Construction Industry Federation are providing funding and support to not only a gender sensitized program, but also one that's specific to the workplace, that focuses on different kind of ages, that focuses on different occupation groups. So Noel was talking about intersectionality. So I suppose really getting the back end to conduct this research is huge change. In terms of sectoral buy-in then from all the large construction industries that have really bought into this program and supported us in our research so far, down to the interpersonal individual level, where we have just met people on the ground working in the construction industry that have just been helping us with this project and really welcome the idea of this project. I suppose where does this lead us, or what do we hope that this real change will be? I know Noel as well talked about this at the start, but we're hoping to change the culture in the industry, that seeking help is not a sign of weakness, that it is a sign of strength, and really trying to change the idea that it's a macho culture, that people can kind of ask each other for help. And I just moved through it on the last slide, but what do we hope the outcome of this will be? And that is to reduce the stigma around suicide and mental health in the industry, to improve suicide literacy. And I suppose what that means is knowledge, skills around suicide, and to improve intention to seek help. And hopefully all of this will contribute to reducing suicide in the construction industry.
Shane, thank you so much. That's a really important piece of work that you're involved in. And again, I've so many questions I could ask you in relation to that, because it's really superb that such a piece of work has been done, especially in construction. It's just one another of groups of men, quite a lot of men, not all men in construction, but a lot of men who are in construction. So we'll bring you onto the panel in a short while and we'll ask you some questions around that. But you can see Diana is joining us. Diana, sorry for leaving you so long, but it's good you're here with us now. I think, Diana, you've been with us before, but at great expense we brought you back, because what you really have to say, Noel has already mentioned on Farm Ground, and we have Farm Connect as well, which is engaging with farmers. And your own experience, of course, has been based around Farmers of Hearts, and a whole group that's really interesting to find out more about. And I know your role has been in relation to research for that, and all the way from the Netherlands, but you've been up there in Carlow with the Men's Health Centre for a good while, and your MA was the evaluation of the pilot program for Farmers of Hearts, which is the Teagasc Walsh Scholarship part of that. So I'm going to leave you over, and then we'll bring you onto the panel. You're not going to get much rest because we're getting close to the panel discussion. So thanks for joining us, and over to you, Diana.
Thank you, Lorcan. Yeah, so I am delighted to be here again, and I'm talking a little bit more about the Farmers Have Hearts, which is, sorry, I have to, yeah, there we are. The Farmers Have Hearts is a year-long health program targeted at farmers, and we recruited farmers at mart settings and agri branches, and it consisted out of a baseline health check, after which the farmers were offered a choice for a health behavior change support program. And they could choose between a health coach by phone, health promoting text messages, both interventions, and those farmers not interested in taking part in an intervention were placed in the usual care group. All farmers were contacted at week 26 by phone, and then were all invited for week 52 for a health check. At baseline, 868 farmers participated, and at week 52, 62% came back. And this was an interagency partnership between the partners you see under the screen. I'm talking today especially about the mart settings.
first, a little insight in who our Mart farmer was. Farmers are considered a lower socioeconomic group in Ireland, and the Mart farmers, compared to the agri-branch farmers in our study, were more often having lower educational attainment, so primary school only, more often single, involved in cattle farming, having smaller farm holders and part-time farmers. They were also significantly at higher risk for cardiovascular disease, with having 4 or more risk factors for heart disease. Now, I have to be cautious because the agri-branch farmers were also at high risk, so we have to treat this cautiously. And we worked on the premise that Mart farmers would have a more traditional masculine view to health and a more functional view of health, and prioritizing health over, or farming over health. The Mart is a setting of workplace for farmers, a place of business, but it is also very much a social hub. It has a strong social function, with farmers coming for a meal, to talk to other farmers, doing some window shopping. And that's why the Mart was a perfect setting to go out there and meet farmers in an trusted, safe space for them, and a convenient space where they had to be anyway, and where they didn't have to change their clothes to take part in a health check. So underlying to work towards change among this group, we deployed 3 pivotal and central placed engagement strategies, which were gender-specific, strength-based, and farmer-centered. And this was to make the program much more agricultural competent for farmers, so designed to their specific needs. So we met farmers in a safe space. We worked around a clear health needs. We embraced the rural masculinities rather than working against them. We offered them choice. We had a non-judgmental approach and a personal approach, and we focused on achievable changes. So we looked at what was possible, and we very much embraced the farming culture as well, and the farming occupational characteristics. So we met them on their turf. We were flexible. We were met the farmers locally. We worked outside of office hours. And these program strategies, they led to feelings of empowerment among the farmers, and a higher level of self-efficacy and increased health awareness. And we had a high participant satisfaction. And as a result, that were the aims of the programs as well. And as a result, we saw that farmers reported at week 52 that they embraced self-care and engaged in self-care, and taking much more responsibility for their own health. And we also saw among this group that health was normalized. It was discussed, and much more attention for prevention of health. So if we're looking at steps for sustainable change working with farmers, what worked in this program was the interagency approach, which meant that the farmers we had a maximize of reach to the farmers, but also the program was much more acceptable for farmers, and we had a high draw-in. We worked evidence-based, settings-based, and had an outreach approach. We deployed clear engagement strategies and had tailored support and follow-ups. And as a result, so these were gender-specific strategies. And as a result, we saw that health was much more normalized in this masculine environment, which is much more towards gender transformative and taking control over their own health. Thank you.
Thank you as well. Very much well done. Sorry, then I was having trouble there. Technology was working against me there for a moment, but that was really, really informative as well. And as I say, we're not going to have much of a chance for you to rest, because some of what you've just talked about, we're going to bring it over to the panel there now in a moment and get everybody to join us. So thank you very much for that insight into Farmers of Hearts, which of course has been a really, really successful program in relation to engaging with farmers. So we want to find out a little bit about that. Just hello, everybody. If we go straight to our panel, we have everybody, I think, there. Thank you very much for staying with us and bringing it back in. I'm just conscious, folks, when we go into the panel discussion, and Noel contextualized, you know, what real change would look like, and it's a really positive lens to put on the key learnings that we have in relation to engaging with men. And I want to keep it on that if we can at all. But I suppose there is $1 million question. I want to ask Noel this question at the very beginning. And it's a simple question, Noel. You know, are as men, are we not interested in our health, or are we doing it wrong forever? That we're not able to approach the great numbers of men in relation to caring more about our health, because we've heard from the different demographics of men that there is a challenge out there in relation to men dealing with our health and masculinities. What's your understanding?
Well, I think the answer is in Shane and Aisling and Diana's presentations. I mean, if anyone spoke to them before they started the programs they're leading out on, they would have said, you're mad to go into sheds, you're mad to go into farmers. Our men in the construction sector would never engage. So really, it's not about labeling men as being a problem or problematic or reluctant to engage. It's really about having the right strategy that sets out to engage men in a constructive, positive way that goes out to communities and workplace settings where men are already at ease and comfortable with the world, asking men what they would like, respecting their inputs into program design, and seeing men as partners in the whole process. In Diana's slide there was very poignant when she talked about things like autonomy and self-efficacy improving, and I think through the other presentations as well. So I think that the danger is that we separate health into, you know, health services, and we don't see it as being part of our lives and part of our, and it's not taking ownership of it.
Yeah, which probably brings us to what Aisling was saying in relation to the sheds. Aisling, when you started to work, for example, in Sheds for Life and put the lens on and started to meet with the men and get to know the men, and you look at the powerful video we just watched that at so many levels talks about really transforming masculinities and men shift. You know, you might think that maybe men of a certain age, my age, even beyond, you know, that we're stuck in the way we might see things. That's not your experience, though, as Noel is saying. You know, the right environment, people will talk, men will talk.
Yeah, absolutely. I mean, I guess the video did really kind of summarize that, but it's about giving people, it's a simple formula. I think for everyone, we're all human, you know, at the end of the day as well, leaving all the masculinities stuff to one side, that it takes time to just build relationships with people. So building that rapport and working with men to ask them, well, what are your needs? You know, what can we do to respond to them? And also, as Noel said, bringing them in as partners in anything that we design or deliver. You know, they should have ownership. And, you know, it was always discussed the Sheds for Life belonged to the men in the sheds. It wasn't something that was ever going to be pushed on them. So they had a shared sense of ownership about that. And that was empowering for men as well, you know, so that was really important. And that worked really well in terms of engagement, because they felt like if they were invested in, you know, and I think that was just, it can be messy work, and it, you know, can seem a little bit complicated, but it actually is, you know, it's just about putting the energy in and building those relationships.
Yeah, and valuing the men. I think that comes across very strongly in it, you know. And Shane, if I can come to you for a moment, because, you know, to go in and to be part of construction, as I say, it's not all men on construction or in construction now, but there's very, very large numbers of men that end up in construction. And you might be inclined, or some people might be inclined to think that is a very stereotypical maybe type of man that might be there in the context of the way we might look at our health or engage with our health, or stigma with mental health. But you didn't find that, or did you? You found a kind of an openness and to be part of the research that you were doing.
Yeah, to be honest, like, I think I would have had my own even though I work in men's health, I was kind of going, I don't know how this is going to go. We had a target of 200 to 300 people to fill out the survey, and we had to stop it at close to 1,700 because people just kept coming forward being like, can I be involved in this research, companies and individual men. So I suppose it just goes to show about well, kind of Aisling had said it, and people like hard to reach, so-called hard to reach groups, and I suppose it's just going in with the right mindset. I think stigma of mental health, just that you mentioned it, can be funny. I think we've come a long way societally talking about the stigma of mental health, and I think people were very willing to fill out the survey. But when it comes down to kind of the individual talking about their own mental health, I still think there is a little bit of stigma there. So it's kind of okay to talk about mental health, but I'm not going to be the one to put my hand up in the crowd. So I think we still have a little bit more to come with that. And I suppose how do we overcome that is really just in our individual reactions with each other, interactions with each other, normalizing those conversations. There's sad things that happen in life, there's angry things that happen in life, and they're natural human responses. And I think as men we try to hide all of those things, and I suppose it's just, you know, it's just normalizing those conversations. And I suppose just that we're talking about it is just the importance of seeking help. It's never too late to seek help. It's not a sign of weakness, it's a sign of strength. And just the more we can have those conversations and actually initiate it, I think that's how we start to overcome some of those issues.
Yeah, and Diana, you hear the folks are saying here, like, you know, the environment is really important, the relational. I think Noel talked about the strengths-based approach. Your experience as well with, you know, meeting the farmers. You know, farmers have hearts at marts, you know, meeting them in the right environments. That's your experience as well, that works well in relation to, yeah.
Yeah, I think that was, you know, pivotal in this project to reach farmers. I think, you know, and that is from Australian research, is that, you know, there's a bit of a mismatch maybe between, you know, farmers and traditional health services, as in, you know, they don't maybe naturally answer to farmer specific needs. And this program was very much like, you know, the Mart is a crazy place. It is loud, it is busy, there is lots going on, and farmers feel like a fish in the water, and there's this peer support dynamic. You know, and Mart farmers didn't go to the Mart in the morning to go to a health check. So they met us there, and just talking about, or, you know, meeting them in a cultural competent place where we talk their language and we were, you know, on their turf, and we had a hook to get them in. And we didn't talk about deficits, as in, okay, X, Y, and Z is wrong, so you have to do this and that and the other to change. But we looked at where they were, where their motivational stage was, and that was tailored then with appropriate behavior change techniques to their level. So every farmer had their own level. It wasn't an one fits all place, and that was very important to connect with the farmers. And also to make them a partner in health. You know, they were learning to what health is. We had a personal approach, we explained, so they could make their own decisions about their health. It wasn't us telling them what to do, it was them understanding what they can do differently to make change. And we were there to support them. So we facilitated them with the tools to actually make some changes in their life and how they could use their farm as a setting for health promotion. So that was very important, to connect with the farmers and to engage with them.
Very good, very good. Aisling, in the context of the sheds, just linked to what Diana's saying, maybe again, the environment, what stays with you, you know, just off your instinct, your intuition, outside of even the research or based on the research, but what was the thing that really, you know, was the conduit for change in relation to supporting men in sheds, that Sheds for Life was and has been such a really good program?
That the ingredients are always there in the sheds themselves, and that, like when I had mentioned that they are so inherently health promoting because of the social support. So that men, you know, came together to support one another, but also having somebody to go in just to facilitate the conversations. So someone just to go in to start, you know, to say it's okay that we talk about this health issue, whatever it might be, or maybe it's around mental health. And then, you know, that's kind of a catalyst then to start kind of almost a snowball effect. So if one man speaks up, then someone else will say, yeah, I actually have that experience as well. And it's, you know, around facilitating the trust there. And there will be kind of leaders and champions that come forward to help that maybe will pull men that are a little bit more, you know, nervous or hesitant about talking about these things along. So that's what works really well. But it's the social support, and that informal delivery is really important. So, you know, it's a facilitated conversation rather than someone going in and delivering a lecture to men, you know. So, and again, tapping into the strengths the men they have so much experience to share themselves, you know. So giving them the space for that.
Yeah. And Noel kind of said the same. Noel, I loved your slide around the Larkin Centre. I've seen that slide somewhere before, but it's a really lovely slide. That was one of your first engagements with such a program. Just can you say a little bit more about that, because it seemed to really catch you in a way, even as a researcher. There was something different about that experience.
I think Aisling and Diana's Jane have addressed this already, but I think breaking the ice and things is really important, and giving permission for men to talk and open up. And once that happens, like, men will sort it out for themselves after that. And I saw some really lovely examples of peer support in the Larkin Centre, and fun as well.
Yeah.
But if I start with the fun, I mean, anytime I visit the Larkin Centre, it was just hilarious. You know, the men were so witty and so sharp, and the fun they had in taking part, whether, especially in the cookery classes. I mean, it was just such entertainment. You know, they were having such fun. So there's a lot in that, but also then their willingness to support one another. I was in a workshop one day, and one man who was on methadone treatment kind of fell asleep in his chair and was kind of slipping off the chair. And another man just got up and walked behind him and gave him support and propped him up. And he didn't say anything. The workshop just continued on. But it was a lovely example of instinctive, you know, behavior to support someone who needed support.
Yeah.
And maybe that was always going to happen, but the Larkin Centre just created that environment that allowed men to talk and to support one another.
Yeah.
And once the ice was broken, I think everything else followed.
Very good, very good. And tell me this, Noel, when I stay with you for a moment, because I'm thinking, you said also that, you know, we're talking about men and change and what real change looks like in relation to health or masculinities. We said it was beyond behaviors, right? It's beyond behaviors, so it has to be bigger than that. And in the context of anybody can come in on this from me, you know, what does real change look like then? You know, what's missing at the moment, for example, maybe in relation to policy or research, as well as just for the men themselves? What do you think is missing, if there is something missing that could add to supporting that real change? Do you want to say something on that, Noel?
That I might begin. I think it's a really good question, Larkin. And I think there's been a real challenge with kind of gender mainstreaming documents and frameworks that have been developed here and elsewhere, and that you know, health service providers don't really understand them or get them. So I think we need some very simple toolkits that would support service providers to apply a gender lens to health service development and delivery, and that would do so in a very straightforward and accessible way. And actually, I was kind of slacking off my colleagues who were asking such basic questions 20 years ago, but in a sense, they were really important questions. So if you start by asking where are the men, that you're already well on the way to figuring out, well, you know, if I'm offering a service and men aren't turning up, as Colin Fowler might say, you know, if you're running a shop and no customers are coming in, you wouldn't say what's wrong with the customers. You'd probably reflect on the shop and say what are you selling or when are you selling it. So by asking where are the men, that's you're on the first rung of the ladder at least, looking at what a gendered approach might look like. And over time then, I think we have a really rich resource to draw upon in the programs that have been described today and others.
Yeah.
And applying those principles and practices really would keep us in good stead. The others might like to add.
Yeah, anybody else like to come in on that? It's from a research point of view.
I have a few thoughts. I suppose, strictly speaking, research, I think we've done a lot of great work on identifying the best practices of engaging men, but I think we need to start linking those to health behavior change techniques and really identifying within programs what exactly is working and what's not working, and linking them to existing theories of health behavior change so we can develop stronger programs. If we develop stronger programs, then we can start running randomized control trials maybe on some programs. That will give us a stronger evidence base, give us more credibility, allow us to get bigger pots of funding to deliver more programs. I think that's something that we need to work towards. I think that when we talk about intersectionality, we need to, I suppose, really do deeper dives into intersectionality and look at how masculinity intersects with different aspects of identity, age, sexuality, occupations, all of those things, to really have a targeted approach of who needs what, when and where. And I suppose finally, the thing I think is maybe missing is those sort of sometimes social programs for men between the ages of 30 and 45 or 50. Like, so, you know, although the sheds are brilliant, I love sheds, I've been in loads of sheds, but sometimes younger men go, I'm not going to go to a shed, I've plenty more living to do, or I'm not retired yet, or that kind of thing. So I think sometimes that kind of age group, maybe we're missing some sort of social programs for that age group.
Okay.
I have something as well. I would really like to see, you know, where the implementation of programs go, and then the translation from the implementation into policy. And as well, maybe longer follow-up. So we have these programs now, you know, my program was a year, 10 weeks, but how does that translate in 2 years or 3 years? So I would like to see that as well.
Very good, very good.
As an add-on.
Follow up on that point as well, Diane. I think it's a really, really important point. And I think it's important that we take a step back as well. So Noel spoke about, well, if the shop isn't working, you don't blame the customers. So having that kind of ecological view, you know, that broader view of what is happening in the environment, you know, what's happening at the systems level in terms of what policies we have. So we're really lucky in Ireland that we have a men's health policy. Lots of countries don't have that, from, you know, so from the top down to the bottom up, well, what's happening, you know, capturing all those facilitators and barriers. How do we address those really important structural barriers that stop men from actually engaging with health, or when they go to seek help, is the support there? So Shane made that important point that, you know, it is becoming more normalized to talk about it, but is the support there when they do, or when they reach out? You know, that's really, really important. And I see there's a question there in the Q&A, and I think it kind of runs nicely along this around, you know, the language that we use. So, you know, blaming masculinity as being the cause for men's poor health as well, you know, and that there is really positive elements of masculinity that can be health enhancing. So, you know, resilience and all of those things are really important. So we need to be able to challenge our views as practitioners and deliverers as well, you know, in terms of, again, just coming back to the question, do we know how to talk about masculinities properly? Are we confident with that? So maybe it's around building capacity there as well.
Yeah. Noel, do you want to add to that about talking about masculinities? You know, it can be the complexity of it. You know, it's not the normal conversation that you'll bring to a football match or to a, you know what I mean? Yeah, I was looking at the questions in the chat, as Ashley mentioned, and one of the participants makes a really good point about, you know, it's so easy to gravitate towards this kind of stereotypical view of masculinity. And one of the objectives of Engage is to actually get participants to reflect on that, and to reflect on their experience of engaging in the past and how that might shape future engagements. Yeah. So I do think we need to be much more, I suppose, generous in our approach to men, and not to assume that all men fall within the narrow confines of the alpha male, you know. Yeah. And even for those that might do that, rather than to blame them for those behaviors or attributes, to ask the question, well, what's driving that behavior? What is it about the cultural environment in which they live that prompts or encourages that kind of behavior? Yeah, that makes sense. Tell me this, and anybody can come in on this. I'm looking at all of you on the screen, and all of you come from an evidence. You underpin the work with evidence, which is really, really important. And I think that's what real change looks like as well, where you have strong evidence. But all of you as well, the evidence you collect, it comes through, what would you say, a lens that's very relational and engaging. So it's not 3 steps away from the process. As I say, Aisling or Diana or Shane, you're very hands-on in meeting with the core and the groups of people that you work with. So you have a really good instinct and experience of what's going on. But linked to that can inform what Noel has just said. Maybe he mentioned it already and he had it in one of the slides. The importance of capacity building then. What does real change look like, you know, in capacity building? Where do we need to be going? or what have we achieved in relation to building capacity of frontline service providers in relation to engaging with men and teasing out what we mean by exploring masculinities. Anybody like to come in on that?
I'll come in, Lorcan, and just begin with, I think the Engage program has been really important, as I mentioned earlier, both in terms of giving participants the skills and knowledge to engage men more effectively, but also encouraging them to reflect on their practice and the culture within the organizations and how open to engaging men they might be. So I think that's been a really positive development. And more recently, as I said, it's branched out into, you know, extending beyond more traditional service providers to engage, say, agricultural advisors with farmers and mental health especially. So that's been really positive development.
Right.
I do think there's a lot more we can do if we're trying to mainstream health across the HSE by getting it into CHO areas and trying to get, we're looking at this, say, with the new iteration of Healthy Ireland Men. How can we, you know, what tasks do we need to take on to mainstream men's health across CHO areas and to incorporate men's health into existing programs along the lines Shane was mentioning there?
Yeah. Anybody else, folks? Is there possibilities? I don't want to ask about gaps, but what are the possibilities then, do you think, based on your own evidence and research around, you know, literally working towards real change and sustaining that? Are there other things we need to be doing? Aisling, have you any ideas?
I think it just, again, it's kind of having that multi-layered view of things. So like, you know, we look at, you know, working with men themselves in terms of their getting men to engage and normalizing meaningful conversations. So very much that transformative approach. But again, it also comes down to normalize these conversations for the people who are delivering these programs or who have an interest in, and challenging the view or maybe the stereotypes that they believe that, you know, it's just a natural thing that men just don't have, you know, as good health as women for all of the complex reasons, and that there's not a whole lot that we can do about it, because there's so much out there now to contradict that, to say that actually it's just the approach. We're not you know, we need to adapt. We need to be able to change our approach. So we can't really keep saying that men are just hard to reach. Again, it's more that you know, we need to adjust how we try to reach them, and all of these programs are demonstrating that actually we can do that. So it's just about, you know, having the energy for that and putting in that effort, and following the evidence.
Very good, very good. Folks, I'm conscious of time because I want to bring Fergal on in a few moments as well. But if I was just to go around and ask each of you, in the context then of real change and what does real change look like, is there anything that really stands out for you? You know, you're a fair while in the field, all of you, in relation to the work that you've been doing. And even though you have specific pieces of research you've been involved in, you've certainly been across other areas of work. And is there something that really stands out for you in relation to what you think is a real change over the last maybe even 10 years in relation to masculinities and health and well-being? What would be the thing that would stand out for you? Anything comes to mind, Noel, for yourself? That you've probably mentioned a few of them already, I think.
I would say that if I was to name one thing, I would say having an open mind in how you approach a particular cohort of men, not assuming they're going to be hard to reach or difficult to engage, but going in a respectful way with an open mind, and trying to bring about incremental change whilst engaging men as partners in the process.
Very good. Thank you very much. Diana, anything stays with you?
Yeah, well, I am lucky enough that I'm, you know, involved with the farmers since 2013 when I started my master's. And this is actually a unique position because often, you know, people come and go on these projects. So I have seen where in 2013, where this was completely new at the Marts and farmers didn't know what to do with this army of nurses and people coming in, to now where they are, oh, there you are again, and, you know, a much more open mind. So I have seen that this consistent attendance and the implementation of the program, you know, what was then a single health check program, start normalizing health. So it is also the persistence and the growing and the you know, of knowledge rather than going in and out. It's not about an injection. It's about, you know, the bandage, which it goes there and stays there to keep it together. And that slowly changes an outlook on health and normalizes health as well.
Very good.
Yeah.
Very good point. Yeah, really good point, you know. So I didn't know you were there that long, Diane. That's great. It's really good to have that consistency there in that piece of work as well. Shane, anything stays with you? You've been up the middle of the field for the last number of years, keeping an eye on all aspects of men's health. Really, you know, just what stays with you, do you think?
I think, Lorcan, it sounds so simplistic, and it kind of touches what Noel said, but just going in, listening, just listen to what people have to say. You know, as a researcher, you always go in with some idea of what the problem is or how to fix it, and you're almost waiting for them to tell you the part that you think you already think is the problem. And I suppose the idea of just going in and listening to people, just sit down. You're not the expert here. They're experts. People are experts in their own lives. So just go in, listen, take on board what people have to say, come up with some ideas and go back and ask those people, is that what you meant? And I think if we all just do that and listen to people, we'll go a long way in trying to help people rather than thinking we know what's best.
Yeah, well said. Aisling, would you like to add to that?
Yeah, I definitely can echo what Shane is saying in terms of, you know, bringing in the expertise in the room. Like it's just so important. The men know themselves better than you could ever possibly know them. They have the tools that they need to change, and it's just about facilitating that. And one thing that I learned from Sheds for Life is that, you know, their own perceptions of what it means to be masculine evolves then, you know, when they have that space to even think about that. And just to, I suppose, remember that men aren't victims of their masculinity, as in they're not powerless against it. It's not just this thing that controls them, you know, that they have a level of agency and they can be reflexive about it, and they can use you know, masculinity in a positive way as well. So it's really important for them to know that, and I think that those perceptions are changing. So, yeah.
Aisling, thanks for that. It's a lovely positive note to end on as well. And just before I bring Fergal in, look, just to say again to everybody, thank you for your presentations. We're super, really insightful. Noel, for contextualizing our conversation here today, and then just the evidence and wisdom that you've collected along the way from literally modeling that approach through your evidence-based research just shows so well here in the conversation we've just had. So I'm going to hand over to Fergal, and thanks very much everybody for being here with us today. And Fergal might have some ideas as well that stay with him that maybe are the key things that he sees maybe as a real change. Might come in on that. So go well everybody, and I'm leaving you with Fergal Fox. Thank you very, very much.
Hello, everybody. Thank you very much, Lorcan, as always, for your gentle stewardship through the webinars. I really appreciate it. And thanks to all the presenters today. I suppose just to follow on from what you were just asking me there about what sticks with me, I just found today's presentations very positive in terms of, you know, where have we come in terms of men's health? Like, that's a question that we're really kind of playing around with at the moment. We're in a phase of trying to finalize our review of the last Healthy Ireland Men plan, and you know, the review that we're looking at is telling us, you know, we've done well in some areas and developing programs, but we need to do better in terms of integrating men's health into some of the, you know, the key policy areas that we have in Healthy Ireland and the Health Service and with the Department of Health. And we need to do a better job maybe of talking up to more influencers that we're talking out a lot in terms of men and different settings. But to look at in terms of where the movement has come in terms of men's health and normalizing health and wellbeing conversations with men, I think, you know, there's been a dramatic shift over the last 20 years since I've been, you know, involved at different levels. And it's really encouraging to see, like just what Shane asked for there was, or one of the things that Shane's asked for, he's got a big wish list there, but one of the things he asked for was, you know, trying to build the evidence of engaging men with lifestyle behavior change as like a, you know, a sweet spot in terms of trying to have kind of undeniable evidence and, you know, build the work that way. I absolutely second that. And that's something that we, you know, that we need to look into doing. But when you look at the settings that we talked about today, or the presenters spoke about today in terms of the workplaces and the farmers and the sheds and the the construction sector. Like this is it's radical shifts what has happened and what needs to happen, I think. And I think the positive door opening behavior of all those construction agencies that Shane experienced, setting out to do 300 surveys and having to stop at 1,700 surveys. I mean, that if that's not a signal that the door is open for us, I don't know what is. We just need to keep pushing it. So I'd like to thank everybody for those presentations. And I just want to mention a few things. As I said, we're trying to finalize our review of the Healthy Ireland Men plan, and we're trying to develop a new Healthy Ireland Men plan late this year, early next year. And we're really kind of debating how we set out to support a healthy masculinity over the next couple of years through the Health and Wellbeing plan that we'll develop with all the agencies and partners. And it's appropriate that all the partners have kind of been supporting this webinar series and our webinar series last year on engaging men, because they're obviously the key to doing it. The link to the Engage training was shared in the chat. I'd like to highlight that for anybody that isn't familiar with the Engage training, and that's available through the HSE Health Promotion and Improvement staff across the country and the Men's Development Network, which Lorcan is part of, obviously. Going back, what else occurred to me there? Just want to say that I really like the Kilcock Men's Sheds video. I know some of you may have seen that before, but it really hits beautifully the spot for how men can just find that encouraging, supportive space to have all types of conversations, and then the incident of them creating a choir. It's absolutely groundbreaking in a very small, localized way. See that happen, and it's beautiful to see. It reminds me of that movie that we were involved in reviewing last year, The Men Who Sing, from a Welsh filmmaker goes home to visit his father after his mother dies and lives for a while with his father, but his father sings in a local choir, and the film kind of traces the importance of that local choir to the father and his sense of connection to other men. It's really, really beautiful film. If you get a chance to see it, Men Who Sing, it's a great one. So just to highlight a few other things that are coming up in HSE Health and Wellbeing land, we have another webinar on the men's health. We have another webinar, International Men's Day, and we hope to have some special guests lined up for that one as well. So keep an eye out for that in the run up to International Men's Day in November. What's coming up a bit sooner is we have an obesity event next week with a focus on young people, children and young people, overweight and obesity. Let's Talk event. You can attend in person or online, and we'll send out details to you about that. That's on the 6th of October, and we have a webinar planned for the World Mental Health Day on the 10th of October, where we'll talk about a range of mental health supports and resources, and we'll get a presentation on the new mental health campaign that'll be launched, literacy campaign, that'll be launched on World Mental Health Day, the 10th of October. And for everything else, our e-zine should be out this week, so you can follow us there and keep up with us. I also like to mention one of our partner agencies, who this month has been doing a women's health campaign, hashtag Her Heart Matters, the Irish Heart Foundation. And the Irish Heart Foundation have been key to initiatives like Farmers Have Hearts and several other things that we are involved in, and they're involved in our advisory group. But they have a Let's Talk About Menopause webinar tomorrow. Tomorrow's the 29th, yeah. So you might want to check that out. So that's all from me. I really appreciate your attendance and participation today, and the best of luck. I'll see you soon. Thank you.